Hi all, this is Santa from IRS Group. So today we are going to deal with an important NCLEX topic. So let's look what it is. So that is respiratory tuberculosis, aka the TB. Alright, what is a TB? That's a bacterial infection caused by the well-known bacteria, the Mycobacterium tuberculosis. You might be familiar with this name, right? Alright, that is a Mycobacterium tuberculosis causing this tiny TB. Alright, it spreads via the airborne route. We know we have the droplet route and the airborne route, and so the tuberculosis is being spread by the airborne route. Once you inhale the bacteria, it's going to enter the lungs, it's going to enter inside the lungs and spreads to the lymph and bloodstream. It's going to spread everywhere. It's going to spread to the bloodstream and even to the limbs. So that is a tiny note about our respiratory tuberculosis. All right. Now let's look into the signs and symptoms. One of the important signs and one of the important point that you have to remember when you hear about tuberculosis is the night sweats. All right, you are going to sweat too much in the night. And then anorexia, that's a fancy word for weight loss. And then cough and hemoptysis. Hemoptysis is nothing but blood-tinged sputum, that is hemoptysis. And that's an NCLEX tip. And then dyspnea or difficulty breathing and shortness of breath. And then you are going to also have fever and chills. Okay, so these are some of the signs and symptoms you are going to have when you are having respiratory tuberculosis. And now you have to remember a memory trick, that is TB, T for terrible cough and blood-tinged sputum, or terrible cough with blood-tinged sputum, or the hemoptysis, and then B for bad infection, that is the fever and night sweats, and even the anorexia or the weight loss. All right. And now let's look into the diagnostics. What are we going to do if to know whether a person is diagnosed with TB or not? The very first thing that comes to one's mind when you hear about TB is the Mantoux test, right? Okay, that is an intradermal injection. You're going to give it dermally, and that requires a 2 to 3 day window for reading to find out what the result is. We need a 2 to 3 day window. All right, and when the test is, if the results needs to be positive, it is over 15 mm in duration. Like if the particular or the pricked area is having a bump or something of 15 mm or more than 15 mm in duration, it is told that the patient is positive for tuberculin skin test. All right, hope you understood. So that's all about our Mantoux test. And then the next one that we are going to do is the chest X-ray and sputum culture test for active form of tuberculosis. And one of the key points that you have to remember on our sputum culture diagnosis is that you are going to take early morning sterile sputum specimen for 3 consecutive days. We are going to take the sputum for in the early morning for 3 consecutive days. So that is the condition when you're going to take the sputum culture. All right, so these are some of the diagnostics of our tuberculosis. Now, one of the questions on ATI, precautions for a patient with suspected tuberculosis. What precautions are you going to take? Airborne precautions, because we know the tuberculosis is being transmitted through the airborne ways. First action for a patient with night sweat, oh, that's a sign of tuberculosis, weight loss, anorexia, hemoptysis or the blood-tinged sputum, and fever and chills. What is the first action? What is the primary action that the nurse is going to take? airborne precautions, because it's going to spread by the airborne, and so airborne precautions has to be taken very primarily, or the initial action, the very first action the nurse should take is airborne precautions. And now, client with anorexia having low grade fever, very low grade fever, night sweat, and a productive cough or a cough with sputum. What is the priority action? What is the first action the nurse is going to do? That is, initiate airborne precautions. That's again, the airborne precautions are very important. Hope you understood the airborne precautions to be taken by the nurse when the infection is going to pass via the airborne route. Okay. The most accurate description of tuberculosis. What is the most accurate description of tuberculosis? Most people who become infected with the TB organism do not progress into active disease. Do you wonder why? Because sometimes, being in a nursing profession, we come across many TB patients, and we might get exposed to TB patients, right? And it is not a matter, or it does not mean that we should get actual or an active TB disease, okay? Because most people who become infected actually or infected with the TB organism does not tend to develop an active disease or an active form of disease. All right, hope you understood. Now, the route of administration of Mantoux test. What was our Mantoux test? The tuberculin skin test, that is intradermal. All right, sputum cultures are taken until 3 negative cultures, and the family members should be also tested for TB. That's again another facts that you have to remember about TB. You have to take 3 negative cultures, or 3 cultures has to become negative before diagnosing that, or before confirming that the patient is negative for TB. 3 negative cultures should come. And family members should also be tested for, or tested for tuberculosis. Now, what are the TB drugs? This is again one of the important question. And when you are talking about the TB drugs, you have to be very thorough about 5 huge NCLEX tips. And they are: medicines last for 6 to 12 months. All the medicines is not like, some antibiotics or some pain medicines. You're not going to take it once or twice, or one day for 1 day or 2 days or for a week. Okay. You are going to take, or the patient is going to take the medicines for 6 to 12 months, or almost an year, or half a year. Okay, half a year. So N95 mask worn all the time. The nurse has to wear an N95 mask because tuberculosis is spread via the airborne route. So N95 mask is very important. Family should be tested for TB. Yes, we know that. We have discussed it before. Sputum samples every 2 to 4 weeks. We are going to take the patient's sputum sample every 2 to 4 weeks. 3 negative cultures consecutively should come in 3 different days. Okay, so 3 different days, 3 negative cultures should come. Then only we can just tell that the patient is no longer infectious for tuberculosis. Okay. Now, all of the TB drugs, we are going to discuss our TB drugs. So there are mainly 4 types of TB drugs. RIPE. This is an acronym, and we'll discuss it further. So all are liver toxic. All of these drugs are liver toxic. So some instructors just use the acronym RIPE. So this is the first one, R. That is the rifampin, or the red fampin. Rifampin, R for rifampin, or think a red fampin. So the key points that you have to remember is, it's normal to have red, orange tears, urine, sweat, or the body fluids. Tears, urine, sweat is normal. It's normal to have a red orange color. It's very normal. It's not nothing, or it's not anything serious. You should not need to report it to the healthcare provider. It's normal to have red orange tears, urine and sweat on taking rifampin. Many children get this wrong. So teach wear glasses instead of contacts due to discoloration of tears. The tears, or our tears is one of our body fluid, and that's going to be also red orange color. So we have to wear glasses or instead of the contact lenses. Okay, and oral contraceptives are going to be ineffective. There is no use taking oral contraceptives when you are taking this rifampin, when the patient is taking rifampin. So use instead, the patient has to take which one? Non-hormonal backup birth control. The patient has to take non-hormonal backup birth control pills. And then monitor for jaundice, okay? And we have to also monitor for jaundice. So these are some things we have to keep in mind when learning about rifampin. All right. Okay. And the next one that we are going to learn about is the I in RIPE, the second one I. That is the INH, or the isoniazid. Okay, so the INH or isoniazid. So that's a number one tested TB drug, and you have to definitely know about this. The I interferes with absorption of B6 or pyridoxine, or B6 is also called the pyridoxine. So I interferes with absorption of B6, so there can be a chance of low vitamin B6, and that can finally land up in peripheral neuropathy. So take vitamin B6 25 to 50 mg per day when you are taking isoniazid. Hope you understood. So this isoniazid drug is going to interfere, or it's going to affect the absorption of vitamin B6 or the pyridoxine. Therefore, a malabsorption is going to happen. Okay, and that finally lands up in low vitamin B6, or very decreased amount of vitamin B6 in the body, and that is going to finally land up in neuropathy. And what are the symptoms of neuropathy? Report if the patient is having new numbness, tingling extremities, ataxia. So when the patient is having, or the patient is showing any of these symptoms, any new numbness, any word, or if you see anything new in the options or anything new in the questions, you have to give that patient attention. Okay, so new is always bad. So anything new, numbness or tingling of extremities, or even ataxia, this gait problem, so that is the ataxia, or difficulty walking. Okay, so in order to prevent this neuropathy, so these are the neuropathy symptoms. In order to prevent this neuropathy, we are going to ask the patient to take vitamin B6 25 to 50 mg per day. All right, and it is also hepatotoxic. So what is hepatotoxicity? So it's liver toxic. What are the signs and symptoms of hepatotoxicity? Report immediately if there is any jaundice or any yellowing of the skin or sclera. Dark urine, okay, don't misunderstand with the red urine, red orange urine. That's a different story, but here it's different. Dark urine is a sign of hepatotoxicity. And then fatigue, elevated liver enzymes. Whenever the liver is in damage, it's going to elevate all the AST and ALT. So hold the medicines and no alcohol. Okay, so these are the symptoms of hepatotoxicity, and report immediately if you see any of these symptoms: jaundice, dark urine, fatigue, or elevated liver enzymes. hold the medicine and teach or no alcohol should be taken. Now, the P is pyrazinamide, and that has not been asked very frequently, so we're not going to learn about this thing so much, but just know that P is for pyrazinamide. And then next one is the E, that is also E for I, the ethambutol. So when you are, thinking about ethambutol, think about E for I. Ethambutol stands for I. All right, report if there is any blurred vision, any blurred vision you have to report. Any color changes, that also you have to report. This information has come up in multiple sections, and teach to have baseline eye examination. When you're taking ethambutol, this is one of the main consideration. Take eye examination periodically. Routine eye appointments has to be taken for ethambutol. All right, so this is a Snellen's chart. So many E's there. All right, never mind. So yeah, when you are hearing about ethambutol, you are going to think about eye, okay? So it's blurred vision and color changes. If the patient tells you about any blurred vision or color changes, you are going to report it very soon. So these are the 4 main TB drugs: rifampin, I for isoniazid, and P for pyrazinamide, and E for ethambutol. Hope you understood. And then let's look at respiratory, airborne and droplet precautions. What all precautions we should take. So when it's airborne, we have the drugs like measles, tuberculosis, and varicella, the MTV, the measles, tuberculosis, and varicella. So these are some of the airborne diseases, or mainly question airborne diseases. You have to take you have to keep the N95 mask if there is measles, tuberculosis, or varicella. So we were learning about tuberculosis this much time, and so we are going to discuss the airborne precautions now. So what all should the nurse take, or what all precautions has to be done? Wear an N95 mask. The staff, the nurse should wear an N95 mask, and the patient should be kept in a negative pressure room. Doors should be closed. No opening of doors. Doors should be always closed. The bacteria is going to go around through the air. So we don't want to we don't want the bacteria to go around the air. So we have to keep the doors closed. While transporting the patient, make sure the patient wears a surgical mask. Okay. And now, when you're discussing about droplet, this is a little side note. So the droplet infections are the pertussis, influenza, meningitis, and pneumonia. All right, these are some of the famous or some of the mostly questioned diseases in droplet infections. So yeah, the surgical mask and goggles has to be kept, and a single room should be given. And teach unlicensed personnel, or the UAP, to wear a mask. So these are some of the important considerations on droplet diseases and airborne diseases. All right. Now, these are some of the top 2 missed exam questions. The first one: patient presents to urgent care 48 hours after a tuberculin skin test. Okay. So the patient has undergone a tuberculin skin test 48 hours. That's 2 days before. All right. The site looks red and raised with a 19 mm of induration. Is that good? No, that's bad, because anything above 15 mm induration is bad, right? The nurse knows which of the following. Select all that apply. What does the nurse know about this? Anticipate orders for a chest X-ray or sputum sample. Is that so? Yes, because we want to look further if the patient does he or she has an active form of tuberculosis. Collect blood for quantiferon TB test. Did we discuss something like that? No, so that's not required. The patient has active tuberculosis. Is that so? No, we are not going to confirm with just the tuberculin skin test that the patient is an active form of tuberculosis. The patient has a tuberculosis infection. That's true. The patient has a tuberculosis infection, but maybe he can be an active form or sometimes may not be. We don't know. Okay, once after doing the culture and chest x-ray only, we are supposed to tell the patient is an the patient has an active form of tuberculosis. Just with the tuberculin skin test, we cannot just confirm that the patient is having a tuberculosis or an active form of tuberculosis. But with the skin test, we can confirm that the patient has a tuberculosis infection. Immediately place the patient on droplet precautions. No, we are not going to do that. We are going to keep him on airborne precautions. When caring for a patient with bacterial meningococcal meningitis, the nurse implements which of the following? Select that, all that apply. Oh, that's something from outside, so that's about meningitis. Anyways, we have learned about droplet precautions too. Advise the UAP to wear a surgical mask. Is it? Yes. Implement padded side rails. Good thing. Keeps light and noise low in room. In a meningitis, we know we have to keep everything low and fine. So keeps light and noise low in room. Place patient to negative pressure room. Is that required? No, that was in airborne, not in droplet. Put on N95 mask before entering the room. Is that required? No, that's even not required because that was even in airborne precautions and not in droplet precautions. All right. So thank you all, and this is all for today, and thank you.